The Federal Ministry of Health says it will inaugurate an 18-man national COVID-19 vaccine task team as part of measures to ensure vaccine security against the virus in Nigeria. Minister of Health Dr. Sage Ehanire said this in Abuja at the joint national briefing of the Presidential Task Force on COVID-19. He said government was reviewing the entry protocols at the nation's borders to reduce risks of COVID-19 importation by sealing gaps in present protocols and responding to emerging threats.
Now that vaccines are known to be close at hand, the Federal Ministry of Health is taking measures to ensure vaccine security, for which this week, towards the end of the week, an 18-man national COVID-19 vaccine task team with 7 terms of reference will be inaugurated. The terms of reference will include generating strategies for acquisition, deployment, and options for licensed production by Nigeria Biovaccine Nigeria Limited. Our options with the WHO GAVI-led COVAX facility remain our first line of engagement. We are quite clearly not yet where we want to be with our testing rate. 10 states have shown improvement in testing rate, while 27 unfortunately even recorded a decline between September and October. We shall therefore continue to engage them to strengthen their capacity for active case finding and testing, because we are committed to lowering the case fatality rate and ensure that more lives are saved from COVID-19. We are by no means out of the woods. Citizens with symptoms suggestive of COVID or those who have had contact with confirmed COVID-19 patients should present themselves in their own interest and the interest of their own families for testing and receive counseling for treatment if positive and as prescribed. Strategies for capacity building to improve knowledge and skills for our health professionals continue, with training of intensivists, of which 3 trainers will be trained per state, including the FCT, who will now be trickling down their training to nurses and other cadres of health workers in their states. Nationwide distribution of commodities to health facilities, isolation centers, and facility upgrading are ongoing to keep health systems ready, including strategies to ensure oxygen availability at points of treatment, and to also scale oxygen availability to state hospitals and PHCs later on.
He commented on the strange deaths reported in Delta, Enugu, Ebonyi, Benue, Bauchi, and Kogi State, confirming it's an outbreak of yellow fever. He also spoke on the success of Tuberculosis Partnership Board meeting.
The reported strange deaths in Delta, Enugu, Ebonyi, Bauchi, Benue, and Kogi have turned out to be yellow fever outbreaks, as confirmed by NCDC, who are responding professionally with rapid response teams to the outbreak. Of about 586 suspected cases, 40 have been definitively confirmed in laboratory tests, with 10 deaths confirmed as at last week.